1 in 3 American adults is walking around with a deficiency that their doctor has probably never tested for. Not low iron, not low thyroid, something else. And the symptoms, the ones that are actually showing up in their body right now, don't look anything like what they'd expect. They don't look like a vitamin deficiency at all. They look like getting older, the exhaustion that won't lift no matter how much you sleep. The low mood that sits just below the surface without a clear reason. The aches that moved in somewhere around 55 and never left. The brain that feels like it's running through fog by mid-afternoon. Approximately 35% of adults in the United States have vitamin D deficiency, and most of them have no idea. Not because the symptoms are invisible, because the symptoms look exactly like something else. That's what this conversation is about. 5 symptoms, all of them surprising, all of them documented, all of them showing up in people over 50 every single day, quietly, without a label, without a diagnosis. Stay with me. Symptom number 1, the exhaustion that sleep doesn't fix. Let's start with the one that most people dismiss immediately. Fatigue. I know, you've heard that before. Every deficiency, every condition, everything that goes slightly wrong in the body eventually shows up as fatigue. So when someone says vitamin D deficiency makes you tired, the natural response is, doesn't everything? But here's what makes this particular fatigue different, and here's why it matters specifically for people over 50. This isn't the tiredness that comes from a bad night of sleep. It isn't the tiredness that a good weekend or a vacation fixes. It's the kind of fatigue that sits underneath everything. That's there when you wake up. That doesn't lift by mid-morning. That makes the afternoon feel like you're wading through something thicker than air. And the mechanism behind it is specific. Vitamin D receptors play a role in producing melatonin, the hormone central to regulating the sleep-wake cycle. When vitamin D levels fall, this regulatory process can be disrupted, potentially interfering with circadian rhythms and the quality of sleep itself. So here's what's actually happening. You're not just tired because of low vitamin D. You're sleeping worse because of low vitamin D, and then you're tired because you're sleeping worse. It's a loop, and because it's gradual, because it builds over months and years, most people assume it's just aging. That assumption is costing them. Now, the UpToDate clinical text is precise about something important. It says that the majority of patients with moderate vitamin D deficiency, serum levels between 12 and 20 nanograms per milliliter, are asymptomatic. Their calcium is normal. Their basic labs look fine, which means their doctor isn't alarmed, which means nobody mentions the vitamin D. But subclinical deficiency, the kind that doesn't show up as dramatic symptoms, the kind that lives quietly in that 12 to 29 range, is exactly the kind that affects energy, muscle function, the quality of rest, the rate at which cells produce energy. Vitamin D helps your cells produce energy, so when your levels are low, fatigue can creep in and sap you. And here's the data that makes this harder to dismiss. A study published in the North American Journal of Medical Sciences examined participants with unexplained fatigue and found that nearly all of them had low vitamin D levels, and that after correcting the deficiency with supplementation, their fatigue scores improved significantly. Now, the sleep dimension deserves its own moment, because it's the piece most people don't connect. VDR activation, the activation of vitamin D receptors, promotes serotonin and melatonin synthesis. Both of these play critical roles in mood regulation and sleep maintenance. Serotonin, melatonin, two of the most important chemicals in the brain for both how you feel and how you rest. And vitamin D is upstream of both of them. When vitamin D is adequate, these systems have what they need. When it isn't, when you're running at 15 nanograms per milliliter instead of 35, those systems start working with less than they need. And here's what makes this particularly relevant for the person watching this right now. Vitamin D stores decline with age. Cutaneous production of vitamin D, the synthesis that happens in the skin when you're exposed to sunlight, decreases as you get older. In temperate areas like Boston or Chicago, cutaneous production of vitamin D virtually ceases in winter. Source: UpToDate clinical text. declines with age, ceases in winter. Think about what that means for someone who is 55, 60, 65. Living in the northern half of this country, spending most of their time indoors, eating a diet that's low in fatty fish and fortified dairy, maybe heavier than they were at 40, which further reduces bioavailability. Older persons confined indoors, or simply spending less time in direct sunlight, may have low serum 25-hydroxyvitamin D concentrations, even when taking what seems like a reasonable supplement dose. Source: UpToDate. The UpToDate clinical text is careful here. It notes that in postmenopausal women in France, a developed country with good health care, the mean daily vitamin D intake from food was just 144 international units per day. More than a third were consuming under 100 units from food alone. The recommended amount for adults under 70 is 600 IU. For adults over 70, 800 IU. And the American Geriatric Society recommends at least 1,000 IU for older adults specifically to reduce fall and fracture risk. 144 units from food, against a recommended 600 to 1,000. That gap lives in the body as fatigue, as disrupted sleep, as the afternoon that feels heavier than it should, as the morning that requires more effort than it used to. And here's the open loop I want to leave before we move to the second symptom. We've been talking about fatigue as the first surprising symptom, but fatigue is connected, directly, biologically, to the second one, because the same receptor network that governs energy and sleep also governs something most Americans over 50 experience without any obvious explanation. Something that looks, from the outside, like a personality change, like getting older, like caring less, but isn't. Symptom number 2, the mood that moved in and won't leave. Here's something I want you to consider. You're 58 years old. Life is objectively fine. Nothing dramatic has happened. Your family is okay. Your health is stable. And yet, there's a flatness. A low-grade gray that sits just underneath the surface of most days. You wake up and it's already there. Not grief, not crisis. Just a heaviness you can't quite explain and can't quite shake. Most people assign that to age, to the accumulated weight of life, to the fact that the world feels heavier after 50, which it sometimes does. But what if part of it wasn't any of those things? What if part of it was a molecule? Vitamin D receptors are located in specific areas of the brain: the substantia nigra, prefrontal cortex, hippocampus, thalamus, hypothalamus, and cingulate gyrus. These are the regions considered responsible for the pathophysiology of depression. Let me translate that into plain language. The brain doesn't just use vitamin D for one thing. It doesn't use it as a passenger. It places vitamin D receptors in the precise regions that govern mood, executive function, memory, and emotional regulation. The hippocampus, where memories form and emotional responses are processed. The prefrontal cortex, the part of the brain that helps you think clearly, make decisions, and regulate your responses. The hypothalamus, the command center for hormones, sleep, body temperature, and the stress response. Vitamin D receptors, in all of them. Vitamin D regulates the enzyme tryptophan hydroxylase 2, TPH2, which controls the rate-limiting step in serotonin synthesis within the brain. Without adequate vitamin D, TPH2 activity declines, serotonin production slows, and mood regulation becomes impaired. Read that carefully. Vitamin D doesn't just influence serotonin the way some vague nutritional article might suggest. It controls the enzyme that determines how much serotonin your brain can make. If vitamin D is low, that enzyme slows down. If that enzyme slows down, serotonin production slows down. If serotonin production slows down, the chemistry of mood regulation shifts. Quietly, gradually, in a way that most people would never trace back to a blood test. And it doesn't stop at serotonin. Animal studies demonstrate that vitamin D deficiency is associated with dysfunctional development of dopaminergic neurons, possibly through reduced expression of tyrosine hydroxylase, the rate-limiting enzyme in dopamine synthesis. Dopamine, the neurotransmitter of motivation, anticipation, reward, the chemical that makes you feel like something is worth doing. When dopaminergic neurons don't function optimally, when the enzyme that synthesizes dopamine is running low, motivation dims, initiative fades. The things you used to want to do feel harder to start. Not impossible, just heavier. And here's the part that should land hard. A 2019 meta-analysis of 61 observational studies found that individuals with vitamin D deficiency had significantly higher rates of depression compared to those with sufficient levels. 61 studies, across different countries, different populations, different methodologies, all pointing in the same direction. Now, and this is important, I need to be precise here, because the research is nuanced. The NIH's own health professional fact sheet notes that the VITAL trial, one of the largest vitamin D trials ever conducted, following over 16,000 Americans for more than 5 years, found no significant reduction in depression incidence from vitamin D supplementation in the general population. However, a 2024 meta-analysis of 31 randomized controlled trials with nearly 24,000 participants found that vitamin D3 supplementation did reduce depressive symptoms, with stronger effects specifically in people who already had depressive symptoms at baseline. That distinction matters enormously. Supplementation doesn't appear to prevent depression in people who are already fine, but for people who are already experiencing low mood and who have low vitamin D levels, correcting the deficiency appears to make a measurable difference. In other words, if the deficiency is part of the mechanism, fixing the deficiency helps. If it isn't, it doesn't. A cross-sectional analysis using NHANES data found that vitamin D deficiency and older age are both independently associated with higher risk of depression in U.S. adults. Older age, vitamin D deficiency, both independently raising the risk. And in the same population, Americans over 50, both are increasingly common simultaneously. Think about what that means for someone sitting at 58 or 65 with a vitamin D level of 16 nanograms per milliliter, which would be classified as insufficient, not even deficient, and a mood that has been subtly flat for years. Their doctor hasn't flagged the vitamin D because the labs look borderline, not alarming. The calcium is fine. The bone density scan hasn't been ordered yet. Nothing is setting off any alarms. And the person is quietly, gradually, invisibly experiencing the downstream effects of a system running on less than it needs. Now, here's the question that the research opens, and it's the one I want to leave with you before we move to the third symptom. We've talked about fatigue and disrupted sleep. We've talked about low mood, flat affect, dimmed motivation, both connected to the same receptor network, both quietly attributed to getting older. But the third symptom, the one that comes next, isn't in the brain at all. It shows up in the body, in a place most people over 50 are already paying attention to, but for the wrong reasons. And the connection to vitamin D is one that most doctors in a standard office visit will never make. Symptom number 3. The muscles that won't cooperate. There's a conversation that happens in doctors' offices every single day across this country. A patient over 55 comes in. They've been noticing that their legs feel heavier than they used to. That climbing stairs takes more out of them than it did 5 years ago. That they've had some unexplained aching in their thighs, their lower back, their upper arms. That their grip feels weaker. That they stumbled last month. Nothing serious, but it startled them. The doctor checks the obvious things: arthritis markers, thyroid, blood sugar, maybe orders an X-ray of the knee. And nobody checks vitamin D, because muscle weakness in a person over 55 looks exactly like aging. It walks like aging. It feels like aging. It is, in many cases, a sign to aging without a second question. But here's what the research shows. Adults with vitamin D deficiency develop type 2, fast twitch, muscle fiber atrophy, muscle weakness, and pain. Vitamin D supplementation reverses these features and attenuates the risk of falls in older and institutionalized individuals. Type 2 muscle fibers. Fast twitch. These are the fibers that respond first in rapid movements, the ones that catch you when you trip on a curb, that stabilize your balance when you step off an uneven surface, that let you rise quickly from a chair without using your hands. The fibers that, as they atrophy, make a person look and feel older, more fragile, less sure on their feet. And vitamin D deficiency specifically targets those fibers first. The vitamin D receptor, VDR, is located predominantly on the fast-twitch muscle fibers. It is therefore not surprising that vitamin D sufficiency increases muscle strength and coordination, enabling prevention of falls. A 4-month vitamin D supplementation study increased intramyonuclear VDR concentration by 30% in older, mobility-limited vitamin D insufficient women. 30% increase in VDR concentration from supplementation alone in women who were mobility limited. Not athletes, not people in rehabilitation programs, just older women with insufficient vitamin D who were given supplements for 4 months. Now let's talk about what's actually happening at the cellular level, because this is the part that nobody explains. Vitamin D deficiency decreases IGF-1 and PGC-1 alpha via the vitamin D receptor. The IGF-1/ACT/FOXO3 A signaling cascade triggers muscle atrophy through a protein called atrogen 1. IGF-1 is insulin-like growth factor 1, one of the primary signals the body uses to build and maintain muscle tissue. PGC-1 alpha is a transcriptional coactivator that protects against age-related muscle atrophy and delays the onset of mitochondrial dysfunction in muscle. When vitamin D is low, these protective signals weaken. The pathway that builds muscle tissue quiets down. The pathway that breaks it down becomes more active. And here's where it connects to sarcopenia. Vitamin D deficiency has been reported to impair muscle strength and increase risk of sarcopenia, the age-related decline in muscle mass and function that influences an individual's risk of falls, frailty, functional decline, and ultimately impaired quality of life. Vitamin D deficiency doesn't cause sarcopenia by itself, but it accelerates it. It adds another layer of depletion on top of the natural age-related decline, and because the symptoms are identical to normal aging, almost nobody catches the connection. From the UpToDate clinical text, with prolonged severe vitamin D deficiency, there is muscle weakness, difficulty walking, and in advanced cases, osteomalacia. But the majority of patients with moderate deficiency are asymptomatic on standard labs. Their calcium is normal. Their phosphorus is normal. And yet the muscle effects are still occurring at a subclinical level. The body is losing ground. The labs just don't show it yet. Vitamin D influences muscle fibers. Deficiency can lead to generalized muscle weakness, increased cramps, and difficulty with normal movements like climbing stairs. Severe cases may impair mobility altogether. Climbing stairs, getting up from a chair, carrying groceries to the car. These aren't dramatic symptoms. They're the small daily erosions that people accept as inevitable, until the day one of them leads to a fall, and a fall leads to a fracture, and a fracture leads to a hospital stay, and a hospital stay leads to a month of deconditioning that an older body may never fully recover from. The fall isn't the beginning of that story. The fall is the end. The beginning happened years earlier, in the muscle fibers, in the slow atrophy that nobody named. And now I want to tell you about the 4th symptom, the one that will surprise you most because it has nothing to do with muscles, bones, or mood. It shows up in a completely different place, one that most people over 50 are already watching with some anxiety. And when I tell you what the connection to vitamin D is and what the research says about the mechanism, it's going to reframe something you've probably been attributing to stress or genetics for years. Symptom number 4. The hair that's quietly disappearing. Let me tell you about something that happens to a lot of people around 55 or 60 that nobody connects to a vitamin. They start noticing their hair is thinner. Not dramatically, not the kind of loss that happens overnight. The gradual kind. The kind where you look at a photograph from 5 years ago and realize something has shifted. The part is a little wider, the ponytail a little thinner, the hairline a little higher. the drain after a shower holding a little more than it used to. And the explanation almost everyone reaches for first is the same one: stress, genetics, getting older. Sometimes that's right. Hair loss in adults over 50 has multiple causes: hormonal changes, thyroid dysfunction, nutritional deficiencies, the natural shortening of the hair cycle that comes with age. It is not a simple story. But here's what a 2024 systematic review and meta-analysis published in Frontiers in Nutrition found when researchers analyzed all available studies, searching PubMed, Embase, Scopus, and the Cochrane Library, on the relationship between vitamin D deficiency and hair loss across different types of alopecia. It was found that 51.94% of patients with alopecia areata, 50.38% of patients with female pattern hair loss, 47.38% of patients with male androgenic alopecia, and 53.51% of patients with telogen effluvium had vitamin D deficiency. Roughly half of people with every major type of hair loss, the patchy autoimmune kind, the diffuse thinning kind, the pattern baldness kind, the stress-triggered kind, had vitamin D deficiency. And for alopecia areata specifically, compared to controls, patients had a pooled odds ratio of vitamin D deficiency of 2.84. In plain terms, people with alopecia areata were nearly 3 times more likely to be vitamin D deficient than people without it. Nearly 3 times more likely. That is not a subtle association. That is a signal strong enough that researchers are now asking whether screening for vitamin D deficiency should be a standard part of evaluating unexplained hair loss. Now, why would a vitamin that most people associate with bones and sunlight have anything to do with hair? The answer, again, comes back to the receptor. Vitamin D supports hair follicle health, and inadequate levels may reduce new hair growth. A severe vitamin D deficiency can contribute to alopecia, an autoimmune condition that results in patchy hair loss, because vitamin D plays a role in regulating hair follicle cycling. Hair follicle cycling. Your hair doesn't grow continuously, it moves through phases: a growth phase, a transitional phase, a resting phase, and a shedding phase. This cycle is regulated by signals inside the follicle, and vitamin D receptors inside the hair follicle are part of that regulatory system. When those receptors have adequate vitamin D to work with, the follicle cycles normally. When they don't, when vitamin D is chronically low, the cycle can shorten, the growth phase can truncate, and more hairs can enter the shedding phase simultaneously. The result is diffuse thinning, not sudden baldness. The quiet kind that accumulates over months and years until one day the mirror tells you something you can't ignore. Vitamin D deficiency can lead to hair loss, but this type of hair loss is often reversible. By addressing the deficiency through supplementation and dietary changes, individuals can often stimulate hair regrowth and restore their hair to its previous healthy state. Often reversible. That phrase matters, because it means this is not damage that's permanent in many cases. It means the follicle, given what it needs, can resume normal function. The research isn't saying vitamin D is a hair loss cure. The relationship is complex and other factors are always present. But it is saying that for a meaningful portion of people experiencing unexplained thinning, low vitamin D is a contributing factor that nobody checked. And this connects to something the UpToDate clinical text makes clear. The people most at risk for vitamin D deficiency are older adults who spend limited time outdoors, people with obesity, people with darker skin pigmentation, people who are homebound or institutionalized, and people who are not consuming enough vitamin D from food. The UpToDate text notes that in a study of postmenopausal women in France, the mean daily dietary vitamin D intake was just 144 international units per day. The recommendation for adults over 70 is 800 IU. For older adults concerned about musculoskeletal function, the American Geriatric Society recommends at least 1,000 IU daily. 144 units from food, against a recommendation of 800 to 1,000. The gap between what most older adults are consuming and what their bodies actually need is large, and it's expressing itself in ways that look, from the outside, exactly like normal aging: fatigue, low mood, weak muscles, thinning hair. 4 symptoms. All surprising because none of them looks like a deficiency. All of them quietly accumulating in a body that is running below threshold. And the 5th symptom, the final one, is the most counterintuitive of all. Because it's not about something deteriorating, it's about something that won't heal, the body's ability to repair itself. And the research on what vitamin D does at the wound site, at the cellular level of tissue repair, is something that will change how you think about recovery, about surgery, about every cut and injury your body is trying to fix right now. Symptom number 5. The body that won't finish healing. Think about the last time you had a cut that took longer to heal than it should have, or a bruise that stayed darker and longer than you expected, or a surgery recovery that stretched out beyond what the doctors predicted, or a cold that turned into 3 weeks instead of 1, or a respiratory infection that came back before you'd fully gotten over the first one. Most people over 55 accept these things as normal, as the natural slowing that comes with age, as the body becoming a less efficient machine. Sometimes that's exactly what it is, but sometimes, more often than the research has historically acknowledged, what looks like slow healing and frequent illness is something more specific, something correctable. Vitamin D plays immunomodulatory, anti-inflammatory, and epithelial repair functions mediated through vitamin D receptors on keratinocytes, fibroblasts, and immune cells, suggesting a direct role in regulating wound healing, infection risk, and systemic inflammation. Keratinocytes, fibroblasts, immune cells. These are the workers at a wound site. Keratinocytes are the skin cells that migrate to close a wound from the edges. Fibroblasts are the cells that lay down new connective tissue. Immune cells are the surveillance and defense force that keeps infection out while repair proceeds. All of them have vitamin D receptors. All of them require adequate vitamin D to function at full capacity. When vitamin D is low, every one of these processes slows. Vitamin D deficiency delayed cutaneous wound healing, associated with impaired inflammatory response, postponed cellular migration process, decreased extracellular matrix production, and inhibited key signaling pathways. Vitamin D supplementation effectively accelerated wound healing in aged skin by modulating inflammation, increasing angiogenesis, and promoting cellular migration. Aged skin specifically. That finding isn't about young, healthy tissue with abundant reserves. It's about skin that is already managing the reduced regenerative capacity that comes with age, and how vitamin D deficiency compounds that reduction into something clinically significant. And here's the surgical dimension, the one that matters enormously for anyone who has had or is anticipating any kind of procedure. Vitamin D deficiency is a common and correctable problem in orthopedic patients, recognized for its impact on infection risk, delayed fracture healing, and poor surgical outcomes. Across studies, deficiency below 30 nanograms per milliliter was found in 43 to 90% of patients. This deficiency was consistently linked to higher infection rates, with infected patients showing lower vitamin D levels at surgery. Post-operative levels declined by up to 40%, which can worsen existing insufficiency during the critical early recovery period when infection risk is highest. 40% decline after surgery, in a body that was already deficient going in, during the precise window when the immune system and repair processes need the most support. Now let's talk about the immune side. Because frequent illness, getting every cold that circulates, every respiratory bug the grandkids bring home, every seasonal infection that keeps coming back, is one of the symptoms people most commonly dismiss as simply a weakening immune system. Vitamin D deficiency is associated with increased risk of respiratory infections. The airway epithelium and alveolar macrophages express the enzyme that produces the active metabolite of vitamin D and the vitamin D receptor. Vitamin D and its metabolites promote the innate immune response, which provides the first line of defense against viral and bacterial infections, while restricting the excessive inflammatory response that, when unchecked, leads to serious complications. The innate immune response. the first responder system, the layer of defense that intercepts pathogens before the adaptive immune system even has to mobilize. Vitamin D is upstream of it. When levels are adequate, that first line is stronger. When they're not, pathogens get further in before the body mobilizes an effective response. A meta-analysis published in the BMJ found that vitamin D supplementation reduced the risk of acute respiratory infections. Not eliminated, reduced. That's the honest framing. Vitamin D is not a vaccine, not a cure. But it is a modifiable factor. And in a body that is chronically low, correcting that deficiency has a measurable effect on how often you get sick and how quickly you recover. Now let me bring all 5 symptoms together. Fatigue that doesn't respond to sleep. Low mood that sits below the surface without clear reason. Muscle weakness that looks like normal aging. Hair that thins quietly over months and years. A body that heals slowly and gets sick frequently. None of these, presented individually to a doctor in a routine office visit, would likely trigger a vitamin D blood test. Each one has a dozen other explanations. Each one fits comfortably inside the narrative of getting older. Each one is easy to accept and move on from. But here's what the science is saying underneath all of them. Vitamin D is not a peripheral player in the biology of aging. It is a hormone. The UpToDate clinical text refers to it as such. With receptors in the brain, in muscle fibers, in hair follicles, in wound sites, in immune cells, in the regions of the brain that govern mood and motivation and sleep. When it is chronically insufficient, which it is in roughly 35% of American adults, the effects accumulate across all of those systems simultaneously, quietly, in ways that look, from the outside, exactly like something else. And there's one more thing, the practical piece, the what to actually do piece, that connects everything we've covered. That's what we get to next. What to actually do. Before I go any further, I want to stop for just a moment. If you've stayed with me through all 5 symptoms, through the fatigue, the low mood, the muscle weakness, the thinning hair, the slow healing, I want to say something directly. Most people don't watch this far. They start a video, they get the idea, and they move on. You've stayed through the whole conversation. And that tells me something. It tells me this is landing somewhere real for you. Maybe you recognized one of those symptoms. Maybe 2 or 3. Maybe you're sitting there thinking, why hasn't anyone tested me for this? That's a fair question, and I want you to have an honest answer. So, if what we're doing here matters to you, I want to invite you to subscribe to this channel. Hit the button right now, turn on notifications, because this is what every conversation here looks like. Real research, real clinical sources. No agenda, no supplements to sell. Just information you can actually use. The people who watch all the way through are the people who do something with it. I think that's you. All right, let's get to the practical part. Because this entire conversation, 5 symptoms, 5 mechanisms, all that research, is only useful if it leads somewhere. Here's what the evidence actually says about what to do. The first question most people have is, should I get tested? The honest answer from the research, and from the 2024 Endocrine Society guidelines, the most authoritative update in over a decade, is nuanced. In the general population, adults ages 19 and older don't require routine testing of vitamin D levels. However, they should aim for daily vitamin D intake of 600 IU until age 70, and 800 IU after that, either through vitamin D-fortified foods or a supplement of up to 1,000 IU. That's the baseline for the general population. But this conversation isn't about the general population. It's about people over 50 who may already be experiencing the symptoms we've discussed. And the UpToDate clinical text is clear that for people in high-risk groups, older adults with limited sun exposure, people who are homebound, those with osteoporosis, obesity, malabsorption issues, or dark skin pigmentation, measuring the 25-hydroxyvitamin D level is appropriate and useful. If you have one or more of those risk factors, or if multiple symptoms from this video feel familiar, asking your doctor to include a 25 OHD test in your next blood work is entirely reasonable. It's a simple, inexpensive blood test, and it gives you a number instead of a guess. From the UpToDate clinical text, for high-risk adults with serum 25-hydroxyvitamin D levels below 20 nanograms per milliliter, vitamin D replacement is recommended. Now, beyond supplements, what about food and sun? The UpToDate text is honest about food. There are very few naturally occurring food sources with meaningful vitamin D. Fatty fish, salmon, sardines, mackerel, herring are the best natural sources. Fortified milk provides roughly 100 IU per 8-ounce cup. Eggs contain small amounts. For most people, food alone cannot reach the recommended intake. Sun exposure is the most efficient natural source, but it comes with complexity. In northern latitudes, UVB radiation is insufficient to trigger vitamin D synthesis for several months of the year. Cloud cover, window glass, sunscreen, darker skin pigmentation, and age all reduce synthesis. The UpToDate text notes plainly that cutaneous production of vitamin D virtually ceases in winter in cities like Boston and Chicago. So here's the practical framework. Simple, backed by the evidence, appropriate for someone over 50 who takes this seriously. Get your 25 OHD level checked if you have risk factors or recognize the symptoms. Aim for a level between 20 and 40 nanograms per milliliter. If you're below that, work with your doctor to supplement with daily vitamin D3, typically 800 to 2000 IU depending on your baseline. Recheck in 3 to 4 months to confirm you've reached the target. Include fatty fish in your diet 2 to 3 times a week. Get whatever safe sun exposure your geography and lifestyle allow. Even 15 to 20 minutes of direct midday sun on arms and legs in the summer months makes a meaningful difference. That's it. Nothing exotic, nothing expensive, a blood test, a supplement if needed, and some dietary adjustments. But here's what I want you to sit with as we move into the final part of this conversation. Because the practical piece, the testing, the dosing, the logistics, is actually the smaller story. The larger story is about what these 5 symptoms, taken together, are trying to tell you. What they reveal about a body that has been quietly running on less than it needs. And what becomes possible when you stop accepting the symptoms of deficiency as the symptoms of age. That's what we close with. I want to start the close with a number. A study published in PLOS ONE analyzed data from 47,478 Americans tracked across decades. One of the broadest examinations of vitamin D status and mortality ever assembled from real population data. And what it found, when it compared people with deficient vitamin D levels to those with sufficient levels, was this. Higher 25-hydroxyvitamin D levels were associated with lower mortality risk. Compared to the vitamin D deficiency group, those with sufficient levels had a hazard ratio for all-cause mortality of 0.64, meaning a 36% lower risk of dying from any cause. The association was strongest in adults aged 40 to 59 and remained significant in those 60 and older. 36% lower risk of dying from anything. In the age group we've been talking about throughout this entire conversation, and a separate meta-analysis, examining 18 randomized controlled trials involving 57,311 participants, found that vitamin D supplementation was associated with a 7% reduction in all-cause mortality. Now, I want to be honest with you about what those numbers mean and what they don't mean. They don't mean that a vitamin D supplement makes you invincible. They don't mean that correcting a deficiency will undo years of accumulated damage or prevent every disease. The research on vitamin D is genuinely complex. Some trials show clear benefit, others show modest effects, and the 2024 Endocrine Society guidelines were careful to note that for healthy adults under 75 without risk factors, routine supplementation beyond the daily recommended intake has limited proven benefit. But here's what the research does say clearly enough to matter. Research published in the American Journal of Clinical Nutrition in 2025 found that supplementing with daily vitamin D3 can reduce biological wear and tear equivalent to nearly 3 years of aging. Researchers found that daily vitamin D3 supplementation prevented the shortening of telomeres, the protective caps on chromosome strands that shorten with age. which is considered a hallmark of biological aging. 3 years. The same number we arrived at from a completely different direction in a previous video on exercise and longevity. 3 years of biological aging, potentially delayed, from correcting a deficiency that 1 in 3 Americans currently has, and most of them don't know about. Now I want to bring everything we've discussed today into one clear frame. 5 symptoms, all of them surprising because none of them looks like a vitamin deficiency. All of them routinely assigned to aging, to getting older, to stress, to genetics, to just the way things are now. Fatigue that sleep doesn't fix. A flat mood that moved in without a clear reason. Muscles that are weaker than they should be, slower to respond, quicker to ache. Hair that has been thinning quietly for years. Wounds and illnesses that take longer to resolve than they used to. These are not the inevitable signature of aging. They may be, in part, in varying degrees, in people whose vitamin D has been running below threshold for years, the signature of a deficiency, a correctable one, with a blood test, a modest supplement, and a little more salmon on the plate. The UpToDate clinical text, one of the most authoritative medical references available to physicians, is precise. Vitamin D deficiency is common, it is modifiable, and for people in high-risk groups, which includes most adults over 50 living in northern latitudes, spending limited time outdoors, eating diets low in fatty fish, it is appropriate to test, to treat, and to recheck. Not because vitamin D is a miracle, but because running below threshold in a hormone that has receptors in your brain, your muscles, your hair follicles, your immune cells, and your wound-healing tissue, for years without knowing, is a cost that compounds quietly. And here's what I want to leave you with. Not a number, not a dosage recommendation, just a question. How long have you been accepting something as aging that might not be? Not everything. Not the things that truly are the natural passage of time. The lines in the face, the need for reading glasses, the fact that recovery takes longer than it did at 40. Those are real. Those are time. But the flatness that has no reason, the energy that doesn't return, the muscles that feel a step behind, the hair that's been thinning since you can't quite remember when. Some of that might be something else entirely. Something your body has been trying to tell you in the only language it has. Symptoms without labels, changes without explanations. A slow, quiet drift that nobody named. A simple blood test. That's the beginning of knowing. A Harvard study found that combining omega-3s with vitamin D and exercise additively reduced biological age, with each component slowing aging individually, and the combination slowing it further. Not one thing, a combination. The same things we keep arriving at from different directions. Movement, nutrition, specific micronutrients, consistent daily habits. Not a protocol. A way of living that gives the body what it needs to do, what it was designed to do. You've just spent 45 minutes learning what most people never ask their doctor about. Don't let it stop here. If something in this conversation landed, if you recognized one of those 5 symptoms, or 2 or more, share this video with 5 people you care about. Not to alarm them. Because the things that change us change differently when someone we trust puts them in front of us. Subscribe to Longevity 50+. Leave a comment below and tell me honestly, which of the 5 symptoms hit closest to home? Which one are you going to bring up with your doctor? And if there's something you want us to go deep on next, a question you've had for a while, a topic nobody's addressing in plain language, leave it in the comments. That's where the next conversation starts. I'll see you there.